Every time we talk about circumcision on this program, it is controversial, and we have some new information that I am sure will be the source of much debate. Fewer Americans are circumcising their infant boys, according to one study, which found that circumcision rates had fallen from 83% in 1960 to 77% in 2010. The research says that varying access to health insurance was a factor in the decline, with results showing that circumcision is 24% lower in states lacking Medicaid coverage for the poor. That's one issue. There's another issue, though, which might shed some light onto this. The data show racial disparities among those who elect their children to be circumcised. Rates over the last year reach 91% for white men, 76% for black men, and only 44% for Hispanic men. So, if we are to consider the increase in the Hispanic population in this country since 1960, when the 83% number was the overall number, this new frame may be more representative of the increase in the Hispanic population as a share of total Americans. Given their significantly lower rate of circumcision, there may not have been an actual change in views on circumcision at all, Louis.
Right. Yeah. It's like always, it's a numbers game. And that's an interesting factor.
We get many emails saying, David, you're Jewish, so you push circumcision. Number one, I've never pushed circumcision. Quite frankly, I think very little about circumcision. However, I did report in the past that researchers say the benefits of the procedure still exceed the risks by 100 to 1, but doctors don't recommend circumcision. They simply explain that it is available. And this is in line with a 2012 statement by the American Academy of Pediatrics, which supports the practice. Brian Morris, who co-authored the report, says infant circumcision should be regarded as equivalent to childhood vaccination. That's a comment that is very controversial, especially in light of the fact that now vaccination itself has become such a hot button issue. Brian Morris goes on to say, as such, it would be unethical not to routinely offer parents circumcision for their baby boy. Delay puts the child's health at risk and will usually mean it never happens. Clinical researchers find the decline worrisome on the basis that circumcision protects infants from a number of complications later in life, such as urinary tract infections, which approximately 1 in 3 men will experience in their adult lifetimes. It also lowers the risk of HIV by 60%, genital herpes by 30%, and cancer-causing strains of HPV by 35%. However, the other side is that anti-circumcision groups have drawn parallels between male circumcision and female genital mutilation, saying both procedures are a violation of human rights, both are done to non-consenting children, and it is unethical to allow a family to make that decision when the child cannot voluntarily consent. There is also the issue of the foreskin decreasing sensitivity, removal of the foreskin, decreasing sensitivity and sexual pleasure. I don't want to take this beyond the medicine necessarily. I just want to reference something that happens every time we talk about this issue. Emails flood in from women like on no other issue, Louis. And those emails overwhelmingly talk about how women, what am I trying to say here? Incredibly significantly prefer sexual intimacy with circumcised men. Is that, I mean, I think that's really the point. And it is amazing. No other issue fires up women so disproportionately on one side of an issue as the discussion of circumcision as their preference. Not that that's how we should be making medical decisions. I mention it only as a kind of anecdote.
Right. The majority of the emails we get fall on that side, but there are women who fall on the other side too and say they don't care. And but maybe those are also people who consider this a human rights issue. I don't know.
I think that it is interesting that this is one over the years. This is all one of the top 3 issues that creates the most reaction from our audience. It is just amazing every time we touch the topic, Louis.
It is, and I know the 3, and you're right. This is probably the number 2 most heated argument.